Next up in Better Health, we look at improvements made to patients' comfort across the Southern District Health Board, entitled Love Your Linen.
I'm Margot Love, I'm Charges of Ward 8B, and the Love Your Linen project started about a couple of years ago when we did a wee video showing what we had done on the linen laboratory here in Ward 8B. It started off with standardised bed making, where all throughout the hospital we had different ways we would make the bed, and working on the group they decided to standardise the way the bed made and also look at removing the under sheet and just making with one sheet, one blanket, and the introduction of the blue blankets. When we started making the beds, I noticed that we actually started having a wee drop in what our linen costs were per month, and I thought, oh, it's coincidental. But then I kept an eye on what the budget was and noticed it was a substantial drop. Part of that was because we were making the bed to the minimum and only putting in what we needed for the patients. So we're starting off with almost like a budget and making an assessment of what the patient needed to put on top.
My name is Coral Duffy and I'm a healthcare assistant in Ward 8B, and I love our linen. We've got fitted sheets and they're fantastic, quicker and faster. It's faster, very fast discharge beds. We're getting patients out of the rooms, wash the beds down, make them up very quick, more for ED to get patients back onto beds. Fantastic. Fantastic, it's good, it's great.
I am very impressed with this fitted sheet and the stretch fabric that you're using. I'm very impressed with that. It's very nice on your feet, very nice, and it's warm. I've been extremely warm last night, and this is just minimalist, one sheet and one blanket. How easy can that be for bed making? Yep. And it's so easily washable. And it surprised me how warm it is, because I'm a big fan of wool. And this is wonderful. I was warm all night, even the 5 o'clock downtime and temperature that we get. I didn't notice any coldness. I had the blanket and sheet were on the bed in the emergency department, and it came with me up here to the ward.
The South Island Alliance are working with DHBs like Southern to make savings, but also have fit-for-purpose linen for keeping the patients safe and warm and happy. Love your linen!